Today, we will address a crucial topic that affects the health of millions of people around the world: dehydration in adults. Dehydration occurs when the body does not have the adequate amount of fluids to function properly. This can be caused by several reasons, from not drinking enough water to a serious illness that causes vomiting or diarrhea. In this video, we will talk about the symptoms of dehydration in adults, which can be a serious indication that you need to seek medical help. Additionally, we will offer guidance on what you can do if you or someone you know is presenting these signs. Remember, this video is for informational purposes only. If you or someone you know is presenting severe dehydration symptoms, please seek medical attention. Now, before we proceed, I invite you to join our health and wellness community. So if you like this content, subscribe to the channel and share this video with more people. Now, let's delve into the topic of dehydration. Dehydration is a condition in which the body does not have the adequate amount of fluids to function properly. In other words, the body is losing more fluids than it is ingesting, leading to an imbalance in the body's water and electrolyte levels. Usually, dehydration occurs due to excessive loss of fluids through sweat, urine, vomiting, or diarrhea, or due to insufficient fluid intake. This loss can be caused by factors such as intense exercises, hot weather, illness, or alcohol consumption. When the body is dehydrated, it can have difficulty performing basic functions such as regulating body temperature, transporting nutrients to cells, removing toxins from the body, and maintaining organs and tissues healthy. Now that you understand a bit more about what dehydration is and how it can affect health, let's talk about some common dehydration symptoms in adults. It is important to remember that not all symptoms appear at once, and the severity of the symptoms can vary from person to person. 1. Extreme thirst. When a person is dehydrated, the body tries to compensate for the loss of fluids, signaling the need for more water. This can manifest as a very strong and constant thirst and can be accompanied by a feeling of dry and sticky mouth. Extreme thirst is a sign that the body urgently needs more fluids to maintain proper hydration and function properly. Remember, not all symptoms appear at once, and the severity of the symptoms can vary from person to person. If you or someone you know presents any of these signs, consider seeking medical help. 2. Dry and sticky mouth. Reduced salivation, along with fluid loss, can cause the feeling of a dry and sticky mouth, especially on the mouth's mucous membranes. This is often a sign of dehydration, as the mouth is an area of the body where moisture is quickly lost. Saliva not only aids in digestion, but also helps clean food particles and bacteria and prevents bad breath. Lack of adequate salivation can indicate an immediate need for fluids, and the person may notice that swallowing food or even speaking can become uncomfortable. Remember, not all symptoms appear at once, and the severity of the symptoms can vary from person to person. If you or someone you know presents any of these signs, consider seeking medical help. 3. Reduced or dark urine. The amount and color of urine are important indicators of the body's hydration status. Urine is a waste product and toxins filtered by the kidneys. When the body is well hydrated, urine is clear to pale yellow, indicating it is well diluted and has a low concentration of soluble substances, including electrolytes. However, when the body is dehydrated, the kidneys conserve water, and urine becomes more concentrated, with a darker color, often an amber or brown shade. Additionally, when a person is severely dehydrated, the kidneys can significantly reduce urine production or even cease production, which can lead to a substantial decrease in the amount of urine. Observing urine frequency and color can provide valuable insight into the body's hydration status. Remember, not all symptoms appear at once, and the severity of the symptoms can vary from person to person. If you or someone you know presents any of these signs, consider seeking medical help. 4. Dry and pale skin. Skin is one of the organs most affected by dehydration, as it is the largest organ in the body and is responsible for many important functions, such as protecting the body against physical damage, regulating body temperature, and regulating fluid loss. When the body is dehydrated, the skin can become dry, rough, and scaly due to lack of moisture. Additionally, the skin may lose its natural elasticity and become stiffer and less flexible, which can be a sign of chronic dehydration. Another sign of dehydration can be skin paleness, as reduced blood volume can make the skin appear lighter than normal. These signs are important indications that the body urgently needs more fluids to maintain proper hydration and function properly. Remember, not all symptoms appear at once, and the severity of the symptoms can vary from person to person. If you or someone you know presents any of these signs, consider seeking medical help. 5. Fatigue or weakness. Dehydration can affect muscle function and lead to feelings of fatigue or weakness. Muscles need water to function properly, and lack of water can affect their ability to contract and relax properly. This can lead to feelings of tiredness and weakness, especially during physical activities or exercises. Additionally, dehydration can affect blood circulation and the delivery of nutrients and oxygen to muscles, which can result in muscle fatigue and weakness. These signs are important indications that the body urgently needs more fluids to maintain proper hydration and function properly. Remember, not all symptoms appear at once, and the severity of the symptoms can vary from person to person. If you or someone you know presents any of these signs, consider seeking medical help. 6. Dizziness or lightheadedness. Feeling dizzy or unstable can be a sign that you are dehydrated. This is because dehydration can affect the balance of fluids and electrolytes in the body, affecting the function of the nervous system. This can result in feelings of dizziness or lightheadedness, which can be intensified by sudden movements or changes in body position. These symptoms are important indications that the body urgently needs more fluids to maintain proper hydration and function properly. Remember, not all symptoms appear at once, and the severity of the symptoms can vary from person to person. If you or someone you know presents any of these signs, consider seeking medical help. 7. Accelerated heartbeats or low blood pressure. Dehydration can affect cardiovascular function, leading to changes in heart rate and blood pressure. When the body is dehydrated, blood volume can decrease, causing the heart to work harder to pump blood throughout the body. This can result in accelerated heartbeats or palpitations. Additionally, dehydration can lead to decreased blood volume, which can result in a decrease in blood pressure. This can cause symptoms such as dizziness, weakness, and even fainting in more severe cases. These signs are important indications that the body urgently needs more fluids to maintain proper hydration and function properly. Remember, not all symptoms appear at once, and the severity of the symptoms can vary from person to person. If you or someone you know presents any of these signs, consider seeking medical help. And what can you do if you present these symptoms? Here are some measures you can take to help relieve the symptoms and prevent complications. 1. Oral hydration. If you are dehydrated, drinking water or oral rehydration solution is crucial to replace lost fluids. Water is essential for the body's functioning, and rehydration can help rebalance electrolyte and nutrient levels. Avoid caffeinated or alcoholic drinks, as they can worsen dehydration. It is important to drink small sips of water throughout the day, especially after physical activities or in hot climates. If you have difficulty drinking, try drinking water at regular intervals and add a pinch of salt or a tablespoon of lemon juice to improve the taste and promote hydration. 2. Rest. Rest is essential for dehydration recovery. Avoid strenuous activities and rest enough to allow your body to rehydrate properly. Dehydration can lead to fatigue and weakness, and adequate rest can help reduce these symptoms. If possible, take a short nap to help restore energy levels. It is important to remember that rest should not be replaced with increased caffeine or other stimulant intake, as this can worsen dehydration. Instead, take a break and allow your body to recover naturally. If dehydration symptoms persist or worsen, seek medical attention immediately. 3. Cool down. Look for a cool and airy environment. Avoid heat to reduce sweating and fluid loss. If outdoors, seek shade or create it using an umbrella. Indoors, use a fan or air conditioning to keep the room temperature cool. If you do not have access to a cool environment, wet a scarf or towel with cold water and apply it to your face and neck to cool down. These measures can help reduce discomfort caused by dehydration and facilitate recovery. 4. Light clothing. Wear light and comfortable clothing that does not trap heat and helps with sweat evaporation. Choose natural fabrics, such as cotton or linen, which are more breathable and absorb moisture from the skin. Avoid tight or heavy clothing, which can restrict blood circulation and increase body temperature. Outdoors, wear light-colored clothes, which reflect sunlight and help maintain a low body temperature. Also, wear a hat or cap to protect your face and neck from UV rays. If possible, change clothes if you are sweaty to help reduce fluid loss through the skin. These measures can help reduce body temperature and discomfort caused by dehydration. 5. Cold baths. Take a cold bath or apply cold compresses to the body to reduce body temperature and relieve discomfort. Cold water can help lower skin temperature and reduce sweating, which helps prevent fluid loss. If you cannot take a cold bath, wet a towel or sheet with cold water and apply it to your forehead, neck, arms, and legs to cool down. If you are at home, place a bowl of cold water near you to dip your feet or hands in, which can also help reduce body temperature. 6. Light feeding. Maintain a light and balanced diet to help with dehydration recovery. Choose foods rich in water, such as fruits and vegetables, which help maintain hydration and provide essential nutrients. Avoid high-fat and high-sugar foods, which can overload the digestive system and worsen dehydration symptoms. Prefer small and frequent meals throughout the day, rather than large meals, to facilitate digestion and nutrient absorption. Avoid caffeine and alcohol, which can increase dehydration and worsen symptoms. Remember that not all foods are equally effective in hydrating the body, and that fluid intake is essential for quick recovery. Therefore, be sure to drink water and other hydrating beverages regularly throughout the day. If dehydration symptoms persist or worsen, seek medical attention immediately. 7. Monitoring vital signs. Stay alert to symptoms such as dizziness, weakness, and rapid heartbeats. These signs may indicate more severe dehydration or the need for immediate medical attention. If possible, monitor your vital signs, such as blood pressure and body temperature, and seek medical attention if there are signs of worsening. Remember that dehydration symptoms can vary from person to person and that the severity of symptoms can worsen quickly, so it is important to seek medical help if symptoms persist or worsen. If you are having difficulty staying hydrated or feel very ill, do not hesitate to seek medical help immediately. 8. Do not self-medicate. Avoid taking medications without medical advice, especially if you have vomiting or diarrhea, as they can worsen dehydration. Medications, such as diuretics, can cause additional fluid and electrolyte loss. Instead, focus on staying hydrated with water or oral rehydration solution. If you need to take medications for other conditions, talk to your doctor about the best way to do so during dehydration. Remember that self-medication can have negative effects, and if you feel that you are not improving or if you feel that symptoms are worsening, seek medical help immediately. Dehydration is a serious condition. Therefore, it is important to be attentive to the signs and symptoms of dehydration and to take immediate measures to rehydrate and prevent complications. Oral hydration, rest, body cooling, and monitoring of vital signs are important measures you can take to relieve symptoms and speed up recovery. However, it is essential to remember that in cases of severe dehydration, seeking medical attention is essential to ensure proper treatment. If you liked this video and want to see more content on health and wellness, consider subscribing to our channel and turning on notifications to receive updates on our latest videos. Your subscription and feedback are important to us, as they help us create relevant and useful content for you. Thank you very much for watching. See you in the next video.